Hello, my name's Rob Jones and I'm the Community Development Manager for the Budleigh Hospital Hub. It's my job to look at working with the communities to see what services they'd like to see at the hub. And I also work with all the services to see how they would deliver those services and how everybody links together. We've put together a short film for you, so you get to see a little bit behind the scenes. Listen to some of our key partners as they explain why we're doing what we're doing and how we're going to put it together, giving a little bit of background as to what will happen over the next few months and how all the activities fit and will benefit the local communities, not just in Budleigh, but in the wider areas as well. We hope you find it useful. If you have any comments, suggestions or ideas, you can always find me. I'm at the hospital most days, or you can contact me in the details below this screen. Thank you.
One of the big worries for me is how we resource the care and the support for our population as they grow older. So over the last few years we've really been looking at models around the world, from Japan to the United States. We've been looking at evidence from the King's Fund and other big national policy think tanks, and probably most importantly some of the real local beacons of great care. And that's really what's helped us develop the vision that is becoming the hub at Budleigh Salterton.
The main benefits are about bringing loads of different agencies, whether that's social care, healthcare, voluntary sector, third sector, all into one building, so that people who need them don't have far to travel, and also the agencies within that hospital, within the hub rather, will be able to communicate with each other and therefore say to a patient or a client who comes in, actually, I think you might be better served by so-and-so down the corridor.
Oh, I think it's absolutely essential. We've got to have a service which is as seamless as possible. It's absolutely vital we integrate social care and health care, both from cradle to grave. And I think that's what we're setting out to do, involving organisations with social care, like age concern, hospice care, and also the clinical side of things. And it's keen that we should have a place that looks after the whole person.
Absolutely. One of the real challenges working in the NHS and in Devon County Council is that there are so many different organisations. It's difficult sometimes to keep a track of who's doing what, and communication is always key. If you've got lots of services all linked into one building and you have really clear routes of referral and access, actually that brings a richness. I think that it can make a massive difference to individual members of the community and the community as a whole, because then people will know where they can go to ask the questions as well.
Absolutely. Absolutely. With the nature of the population in Budleigh and the surrounding area, I think this sort of facility is desperately needed. I think it's pretty much a first. I know there are some other facilities around, but it's the way we should be moving forward in Devon.
I think it'll work really, really well. It's a really exciting time that we're going through at the moment. It's something that's very different. We've not been through this before, and to integrate the health and the social elements will work incredibly well.
I've always viewed Woodbury, Exmouth and Budleigh as one big area. I know that the villages have their own identity and their own particular needs, but I would really like to think that this is open to people external to just the Budleigh GP practice area, because I think it will just open up opportunities for people that aren't there at the moment.
A well-being hub fulfills all the criteria set by the King's Report and by the Devon County Council's Strategy and Wellbeing Committee. We've reached a point now when we're looking closely at the hospital to formulate the most efficient design. However, our community can be reassured that numerous consultations have taken place, and when the League of Friends became involved in this, it is trying to represent all the views and needs of our community. As chairman, I am convinced that this has now happened.
I'm often asked what a healthy living centre could look like, particularly to give people a better idea of what to expect over in Budleigh. Well, we work with one of the best partners in the area, a charity, Westbank, who have established a healthy living centre in Axminster, which has been running for a number of years. This Healthy Living Centre supports people of all ages with everything from a creche to a restaurant to gym space to physical activities to health and welfare support. Everything you need is in one place, so all you need to do is to go to one building and there are people there that can help you. And we know from the feedback that we've seen through the local communities, it's been hugely effective. We feel very strongly that this model works beautifully and would fit this hub perfectly. So we're now working with Westbank, who are helping us develop this project. We hope this next section of the film will give you a better idea of how that works.
Well, it's a real community resource. It's available to all ages and people with disabilities as well as those who are able-bodied. So it's very much a centre for people to come to learn how to improve and maintain their health, whatever starting point they start with. As our experience here is that a community resource based in a person's community is a place where they feel comfortable going. And we all know with the increasing demand on health and social care that it's really important that communities develop the ability to care for those within the community who need support. So I think it's tremendously exciting, and based on our experience here, it can really be life-changing and help people maintain their independence, which is a really important thing.
For all of us, as we grow older, our healthcare needs are changing. And we as a community have to change our attitude to healthcare, and we want a more integrated approach to clinical and social services. The Budleigh Health and Wellbeing Hub provides that opportunity. One of the main benefits of the hub is that it will be open to all ages, and not just with the clinical and social, but it also will provide a facility for the whole community.